Good day. Welcome to this lecture called Essential Economics for Biomedical Students. My name is Kailit Phua, and I'm a retired professor of public health at the School of Medicine and Health Sciences, Monash University, Malaysia campus. Some biographical details. Lecture objectives. First, to gain an understanding of economics as a social science discipline. I understand that many medical and biomedical students do not have had a background in economics, so this is one of the objectives of the lecture. Second, to appreciate the usefulness of basic economics in the treatment and management of disease, including chronic disease. Finally, to appreciate the usefulness of basic economics knowledge in managing public health activities of the Ministry of Health. Some of you eventually may join the Ministry of Health of your various countries, and economics knowledge would be very useful for you. Now, what is economics? Economics is one of the social sciences, and it focuses on the production, distribution, and consumption of goods and services. Now, services can include such things as clinical care provided by medical doctors in clinics or hospitals, or disease prevention activities carried out by the Ministry of Health, such as vaccination. For example, the mass vaccination against COVID-19 pandemic in many countries all over the world. There is also consideration of how the factors of production, commonly grouped into capital, labor, land, and sometimes managerial expertise, are used to increase or maximize objectives such as productivity, efficiency, or in the case of private sector companies, profits. These are what I consider useful economic concepts for biomedical people: rationality, scarcity, productivity, efficiency, opportunity cost, diminishing returns at the margin, marginalism, moral hazard, adverse selection. Now, what is rationality? Rationality, example at the individual level, rational behavior would be you list down your goals, career-wise, in life, etc. You rank order them from what you consider the most important to the least important. Then you decide on the most efficient ways to achieve maybe your top 3 goals. An example of rational Ministry of Health behavior would be to identify the health conditions that contribute the most to the national burden of disease. And then you allocate your resources or spend your more resources to deal with the most important conditions which contribute to a higher burden of disease. Now, burden of disease is measured by things such as YPLL, or years of potential life lost, or DALYs, disability adjusted life years. Concept of scarcity in life, there's things such as time, money, in the case of organizations, human resources, and these are limited or scarce, and therefore, to be rational, we should use this optimally, deploy this optimally in order to achieve what we consider desired results. Therefore, deciding rationally on what course of action to take in the face of limited resources or making choices is important. Productivity. Economists emphasize a lot on productivity. This concept deals with how to increase the production or output of desired goods and services per unit of input So input can be things such as time, productivity at the clinical care. One example is you are able to see more patients per hour in the outpatient clinic. So the more patients you can see, that means you are being more productive. Another way is you delegate paperwork to non-clinical staff so that you can spend more time treating patients. Productivity in public health activities, example, being able to vaccinate more people per week, being able to screen more people for a particular disease X per month, or being able to vaccinate for more than one disease per visit per patient. Example, using the DPT vaccine, diphtheria, pertussis, tetanus vaccine, the triple vaccine. So the patient does not have to come for 3 separate occasions for the vaccines. Efficiency. There are different kinds of efficiency. Example, allocative efficiency, technical efficiency. Allocative efficiency, example, the Ministry of Health has to decide which resources to allocate to which kind of care. For example, should they spend more on clinical care or more on public health, right? Or adjust the balance in order to raise the overall health status of the population. Another example is technical efficiency. In colloquial American English, more bang for each buck, each dollar you spend, more bang for the buck. That is, can outputs be raised further without increasing inputs? Can more services be supplied without spending more? Example, you use less expensive or less intensively trained staff, such as nurse practitioners or physician assistants or health assistants, in larger numbers instead of GPs, general practitioners, in public clinics. There's also a concept called opportunities cost. Strict definition, economic definition is the cost of the second best alternative Y, which you have to forego in order to do X, right? When you do X, you cannot do Y. So example, when a patient has a limited budget and buying a month's worth of a drug for a particular medical condition means there is less money available to buy nutritious food, right? So that's the opportunity cost. You buy more drugs, you have less money to spend on nutritious food. In the case of medical students, if you spend more time surfing the internet, you have less time to spend studying. Another example, at the organizational level, when the Ministry of Health is forced to spend $1 million on COVID-19 vaccines, then the result is there's $1 million less to spend on anti-cancer drugs. Diminishing returns at the margin, right? Diminishing returns. As more units of inputs are applied, the return per unit of input will diminish. Eventually, the cost per additional unit of input will outweigh the benefits per unit of input. So for example, if more and more units of an anti-cancer drug are given to the patient, the side effects arising from the anti-cancer drug may get worse for the individual patient. Eventually, the patient may actually be harmed by the drug administered. Moral hazard simply means that the chance that something is more likely to occur simply because it has been insured against. For example, a young man is more likely to engage in a high-risk sport when his health insurance plan covers sports injuries, when he doesn't have to pay money out of his own pocket, out of pocket for any injuries suffered. For example, a patient is more likely to ask the doctor for a more expensive proprietary or branded drug instead of a generic drug if the patient's insurance plan covers the cost of the branded drug. Adverse selection. This means actions by others that increase risk for a particular different party. So for example, healthier individuals will opt out of a public medical insurance program if they are allowed to do so. And then the result is that over time, the composition of the people who still remain in the program would tend to become older and sicker. And this may threaten the financial solvency of the entire program. Too many elderly people and sick people vis-a-vis younger people and healthier people in the program, because the latter groups opt out of the program. A few more economic concepts which can be useful. First is demand. What purchasers want, and they have the money to buy for it. So have the money to buy for it means effective demand. You have the money to buy what you wish to buy or what you hope to buy. Supply, the quantity of a good or service available for sale. Utility, simply a term which means satisfaction, the satisfaction experienced by a consumer. Utility. Market is a place where buyers and sellers of a good or service interact. It can be a physical place, a physical market, or it can be online, and so on. Market failure. The market does not work properly. For example, it fails to efficiently provide goods and services for various reasons. Example, monopoly, one seller. So if there's only one seller for a particular good or service, the chances are that the less of the good or service will be supplied and at a higher cost. Price fixing. If there's only a handful of sellers, an oligopoly, they may get together and fix prices, right? They make some sort of arrangement to charge higher prices, to reduce competition against each other, and so on. Then there's also governance failure, or government regulations fail to work properly. Example, regulatory capture by those supposedly being regulated. So government agency acts as supposed to regulate certain factories, providers, etc. But actually it turned out that for some reason, those who are supposed to be regulated get to have influence over the regulator authorities, so that the regulator authorities more lenient to them, close a blind eye, etc. So that's a regulatory capture. Okay, here's a book I have authored where I minimize the use of technical language. I've co-authored actually. Okay, it's called Health Economics, an introduction for biomedical and other health professionals. This is the end of the lecture. Thank you for listening. Goodbye.